So that's what's great about this technology is there's so many things that it can address. So the most popular normally is, especially the jowls, all of us ladies, we don't want the jowls. So
Mhm.
lower face, submental area under the chin, we don't want the turkey neck, the loose skin under here. So
Mhm.
our lower face area includes both the jowling all across the cheeks and then also under the segmental areas to give you that really nice V shape and to make your jawline very nice and sculpted.
Hi, everybody. I'm Dr. Christi Pramuji with LifeSculpt by ChristiMD. Thank you for watching the podcast today and for tuning in. If you're watching on YouTube or listening on Spotify or Apple Podcasts, I am so thankful that you are here with us today. And my goal is to just educate you about all the latest and greatest biohacks, longevity medicine, urogynecology, weight management, and aesthetics. And today our focus is on aesthetics, and sort of the hot new topic in aesthetics is face sculpting. And I'm very pleased to announce that we have here at LifeSculpt by ChristiMD, we have one of the most advanced, effective, minimally invasive treatments that can erase years from your face. And very pleased to offer this to my patients. I am a patient myself. I'm literally 2 days from treatment. If you look, you can see swelling and bruising of my upper lip and my neck. I think it's, a little noticeable, but it's not something where I feel like I need to hide in the house for a few days. So I'm really looking forward to seeing the results as the skin in that area begins to tighten up. Now, part of bringing the Agnes on board is we brought on a new laser specialist, aesthetic laser specialist, and Kimberly Johnston is here with me today. Welcome, Kimberly, to the practice and to the podcast. I'm so glad to have you here with me. So what I want to do is I want to educate our listeners and viewers about face sculpting, which is a new way of thinking about aesthetic procedures, where rather than going to plastic surgery, which costs tens of thousands of dollars, using wonderful technology to get the results that we're looking for.
Right.
So I wanted you to tell us briefly about your background and why you're passionate about this.
Well, I used to be a surgical tech for many years, and I loved it. I loved helping in surgery, but then I started learning about lasers and aesthetics. And once I started learning, I became obsessed with it. So now, 10 years later, I still love it. I love it even more than I did the first day. So I'm just super excited to be here.
Yeah, I can attest to the fact that she is very passionate about it. We actually worked together in the operating room. That's how we met a few years ago. So it's really fun to work together again. Okay, so let's dive in. So the major tool that you're using for face sculpting with your patients is Agnes Precision RF.
Yes.
So can you tell us a little bit about the Agnes Precision RF?
Yes. So Agnes is a non-surgical radiofrequency device that uses ultra-fine micro needles that penetrate the skin. And when they penetrate the skin, it does two things. When it goes into the skin, you're obviously making a micro injury, which is going to produce collagen because that's your body's natural healing process, right?
Mhm.
But what's cool about this is instead of other technologies where the radio frequency is non-invasive, it's just supposed to go through the skin on its own with no penetration. This delivers the radio frequency deep down in the tissue layers, which helps the tissue to basically remold. So I'm able to sculpt and to manipulate the tissue and basically put it where it used to be. I can make the skin go back and it actually stays. And it's pretty amazing. You can see it as you're doing it. You can see the transformation as you're doing the treatment.
Yeah. Having said that, can someone expect immediate results from a treatment like this?
Right. So even though when you walk out, you will feel a little different. But even within the first month, you will see some minor changes. But with like anything else in aesthetics, it takes time. So you're improving and your results show, and they keep getting better and better, even up to 6 months post-treatment. So that is pretty amazing. Your skin is still repairing and improving up to 6 months after.
Yeah, and having used energy-based devices in the intimate wellness area and then in other aesthetic areas of the practice, that's the same case. It takes a few months because we're encouraging the body to repair itself, remodel itself. We're showing it what to do and stimulating it to do what it's designed to do, pick things back up, lift and to heal, build up the collagen to reshape the face. What is the ideal face shape what happens when we age that makes us look older compared to a younger face? And what are you trying to accomplish when you're looking at a client and trying to help them?
Right. So, we all have these things. Most women, we have the jowling as we get older, right? So, like, why does that even happen? So as you get older, your bones start to shrink. You lose that bone structure. So what does it do? You don't have that foundation to keep the skin up.
Yeah, like the cheek bone structure for people who are not watching on the video the cheek bone structure is what holds up a lot of that. And so you're saying that when that bone structure goes away, that this all kind of starts to sag down.
Starts to fall. And then as well, your fat pads migrate. So that's when you're left with flat cheeks and some hollowing under the eyes sometimes. And then you also have the saggy and the jowls at the very bottom. So what we're basically doing is we're going to get that foundation nice and ready, and we're going to get it strong. So we're getting thicker, better skin through production of brand new collagen and elastin. So we're just basically, like you said, we're tricking the body into doing the work itself.
Yeah, and the face shape, what happens as we get older is our face goes from a nice V shape, right? And then we start to get the squaring off. Right. And that's what kind of takes away some of the youthfulness and femininity. And so this is the design to help restore some of that shape. Yeah. And then you can combine it with other treatments such as very subtle natural cheek filler to build up that bone. In our aesthetic center, we are going for very natural results. We don't want anybody to look overfilled or look strange. So we're just going for natural, just to kind of restore someone back just a few years.
Yes.
How would you say the recovery of this is compared to the recovery of plastic surgery?
Oh, wow. So
you worked in plastic surgery for a while, right?
I did. So the recovery from plastic surgery is not fast. I always tell people it's a couple weeks of bruising, swelling, and then at the end of that, you still have residual swelling, and it doesn't end there. Then you have to treat the scarring. You're very limited on what you're able to do in your normal life, but also you are required to do aesthetic treatments to kind of supplement the surgery anyway. So people think that when you have the surgery, it's done and you're gonna look great forever, but that's not the case.
Yeah.
And even plastic surgery is temporary as well. So this is a really good alternative for people that are looking for something that's just less downtime and a little less invasive.
Yeah, I was shocked recently to hear that a facelift is anywhere from $40,000 to $90,000 depending on the search, and I had no idea it was that expensive.
Yes.
So this is much more affordable. So what are some of the areas that you can treat with the Agnes Precision RF, starting with the face? What are the most effective areas?
So that's what's great about this technology is there's so many things that it can address. So the most popular normally is, especially the jowls, all of us ladies, we don't want the jowls. So lower face, submental area under the chin, we don't want the turkey neck, the loose skin under here. So our lower face area includes both the jowling all across the cheeks and then also under the submental area. So give you that really nice V shape and to make your jawline very nice and sculpted. That's probably my number one thing. Number two would be the eyes. So we can do treatments for ptosis, so upper eyelids that are saggy that can even affect your vision sometimes. Before, the only option was to get eyelid surgery, and so now it's pretty exciting that you don't have to have surgery for that anymore. So I can lift the upper eyelid, give you a nice opening, make your eyelid nice and fresh and open and tighten that skin up. But I can also treat eye bags, which is amazing as well, because really there's no other alternative out there, so
it's a very difficult area to treat. Patients ask me about that all the time, and I really didn't have anything to offer them until now. So it's incredible. What other areas do you like to treat?
I love to do brow lifts. So it's very simple. You go a 2-inch wide area right up from the brow to the hairline, and it gives you a nice little natural curve. It does also help in turn lifting the eyelids for people that have heavier eyelids. So I do a combination of upper eyelid with brow lift, and it works really well. I love to do that. I love to do lip lifts. So that's a nice alternative. I know a lot of people do lip lifts with Botox, which is great, but this is going to last a lot longer.
Yeah. And that's one of the things that we did Monday. So she's done the lower face on me a few weeks ago, and the under here. And then 2 days ago, or at the bruising, is the lip flip. Because one thing that happens as we get older is this space right here between the bottom of the nose and the top of the upper lip, that begins to elongate, and that makes us look older. So this is a way to kind of help that to stay, to shorten that up and give us a more youthful look, the way we feel inside, which is what we're all about. We want to be healthy and feel great inside, and we want that to reflect on the outside. And then the neck. I had 2 days ago, and she can still see it's very swollen and bruised. So that's still, and all this is going to remodel over time. I've struggled with a wrinkled neck since I was a baby. So it's just part of who I am. So I don't know. We'll see how far we can go with it. But, hopefully we can get some of this will tighten up over time.
Right.
And then I think there's some other creative things that the Agnes Precision RF can do. Do you want to tell us about those?
Yes. So I can actually, I've also, to add on to that, is if you have some deep forehead lines or your 11s are really deep, and even with Botox, you're not really able to get rid of those lines. Obviously Botox is necessary. We don't want them to get worse, but I can treat lines on the forehead and in the glabella area, and it will almost not eliminate, but very close to eliminating those lines. So that's a really cool thing that you can pair with Botox as well. But as far as other areas, which is really cool, is hyperhidrosis. So it's overactive sweat glands in the armpit area. So people that, would have Botox injections, or they would have the surgery, which is very painful. Or there was another technology that used microwave to destroy the sweat glands, which it works, but it's extremely painful. I've actually had it done. But now we can do it with Agnes. So with the needles, we can go in and it actually will destroy the sweat glands.
That's awesome.
Yes.
Cool.
So it's not as painful. You don't swell up like the other treatments, and it's much faster treatment.
I love it.
And then as well, we can treat acne. So just like with the sweat glands, the needle will go into the sebaceous gland and it will destroy that. So once we destroy that glands, either gland, it will not come back. It won't return. So you ultimately can get rid of acne for good.
Yeah, and that's just life-changing. Someone that has cystic acne, and if they don't treat it, they'll end up with a lot of scarring, and they can end up with that all those bump craters on their face. So we can help them with that. And then it can also be used for saggy skin anywhere on the body, around the belly button, on the knees, right? Anywhere like that.
I had a patient, she had a liposuction on her abdomen, and there was just this little area right below her belly button. And so she's always been told, well, there's really not much you can do about that. So I actually did the treatment and we tightened it up, and it looks amazing. So she's very happy.
Very cool. And is it just one treatment and then you're done, or does it take a series of treatments like so many other aesthetic treatments?
Right. So for skin or for sculpting, it's usually 2 to 3 treatments to get the ultimate result.
Yeah.
And then for acne, it's typically 3 to 5 treatments, same as for hyperhidrosis.
Okay. And then what does the downtime look like?
Downtime is about a week of bruising and swelling. Usually subsides within 7 days. You do have the only restriction, no, strenuous activity for, 5 to 7 days. But other than that, it's very straightforward and simple.
Yeah. And having, done this twice, I can tell you that Kimberly's technique is very minimally minimally uncomfortable, discomfortable, new word, minimally uncomfortable. We do have in our office, we do have Pronox, which is like laughing gas. It's nitrous oxide gas. It's very, very safe. Patient self-administers, so you just can't, the way it's designed is you can't overdose on it. And then she numbs the area very well, so that you can hardly feel during the treatment. It's very, very tolerable, very doable. Takes a couple hours to do, depending on the area that you're doing, but I would anticipate, give yourself a couple hours to do it. And then there's before and after care, right? Like we give the patients the exosome treatment as part of the complete package, which they can apply a few days before and then a few days after, which really speeds up the healing. Yes. And then you can also combine that with something called Arnicare, which I get at Whole Foods, and just slather that on there, and that really helps minimize the bruising. Okay, and then how long do you expect the results to last?
So if you complete the full series, it's recommended. They did actually a study, and they followed several patients, and over 3 years they followed them. So once they completed the treatment plan, the results were still holding even at 3 years.
That's wonderful.
So that's
great.
That's amazing.
Yay. I love it. I'm so excited. I mean, I've seen so many great before and after pictures from various sources and your own patients that you've treated elsewhere. And so I'm just so excited that we can offer this for our clients here now. And I'm so glad you're here with us. So thank you for listening today. I hope that you'll subscribe and follow us on social media and listen in. We're going to continue to bring you great content every month, and just feature the full gamut of what is available for especially for people in middle age and beyond. We're really pressing into living the fullest, longest, healthiest life possible. So thank you so much, and may God richly bless you today. Bye-bye.